Awesome. Okay. So I'll go ahead and get started. Hopefully you guys can hear me. Hopefully there's not any issues with that. Feel free to comment at any time and ask questions. I would love for you guys to ask questions. I want to know what you're curious about. I want to help you with all of the things that you are curious on, that you need more information on. I am super passionate about working with moms, especially first-time moms. So as many of you know, thanks, Elena. Dr. Xavier and I have a 10-month-old baby, James, and just going through the process of being pregnant and going through the providers, I was kind of, hey, Mandy, I was kind of just shocked as to how little information that we're given. I just kind of felt like I went to these appointments and it was like, here, pee in this cup. Here, we're going to do this. We're going to do this. We're going to do this. And I was never really informed as to, well, what are we testing for today? Why am I peeing in this cup? Or what are we doing? And I just was like, if I feel like this, and I've taken so many classes on pregnancy, on birthing, just with my chiropractic education, because I do have a passion to work with moms. I said, if I feel like this, I can't imagine what people that don't have this knowledge that I already have are feeling like. So if you've been to my office before, you know that I give you a little pregnancy packet with tons of information in here, just of resources for support. And so if you don't have that and you're a patient here, or even if you're not a patient here, I'm happy to share that information with you. But I'll be going through some of that in this class. I'm going to be focusing a lot on this class on pregnancy and then some on postpartum. But just kind of going through what does that process look like, especially here in Louisville, because we have tons of amazing support options out there. And just knowing that those things are available to you is absolutely amazing, and how to make sure that you have the best pregnancy ever. I meet so many women, especially when I'm out, in the community, that say like, oh, I have this sciatica, or I just feel like crap and it's just because I'm pregnant. So you don't have to be like that. You can enjoy your pregnancy. Of course, your body is changing and your hormones are changing. So weird things, your body's gonna do weird things, but that doesn't mean that you have to be miserable the whole time. So I want you guys to just have the best pregnancy and the best delivery possible. So this picture right here that you see, that is James's first adjustment. So it's a really special picture to me. So the midwife, you can see, was doing her examination right after James was born. Of course, we did skin to skin for a while. I think she started the exam, I want to say 1 to 2 hours following. So she didn't like whisk him away from me right away. She let me breastfeed him, or attempt to, and she let us do skin to skin, and then she did all of her testing. And so I said, can I adjust him while you're doing this? And she's like, of course. So she's listening in right there, and adjusting his top bone. And the reason why that's important, as birth is an extremely traumatic process. I mean, think about, for mom and baby, think about what the baby has to do, like their cranial bones. And it's kind of amazing that like this is how God created babies, but their cranial bones of their head, they're literally like, not, this is drastic, this is an exaggeration, but they're literally folding down so that they can go through the vaginal canal. And if there's any kind of pulling on the baby's head, which that's another thing that I want to hit on, is when you are birthing that child, don't let anybody pull on that baby's head unless there's some reason why it's medically necessary. There is no reason why that baby should be pulled on. And that's big. We're like, don't touch my baby's head. Don't touch my baby's head. Now, if there's shoulder dystocia, or there needs to be some kind of rotation, that's fine. But I've seen videos of pulling in these babies' heads, and it's horrifying. And that doesn't need to happen. And of course, our body's stress response to that is going to be to a protective state, right? So if there's pulling, that top bone, it's going to tend to protect the spinal cord, to protect that brainstem. But even without any pulling, it's a very traumatic process. So just making sure that that top bone is in the right place. And if you've been adjusted before as an adult, you getting your adjustment is not the same as your baby getting adjusted. So your adjustment, you might hear the cracking and popping. It's called cavitation. But your baby, it's like if how the best analogy that I've ever heard is, if you have a stick of butter and you put your finger on the stick of butter and the butter melts underneath your finger, That's how gentle a baby's adjustment is. And from there, you're just making sure that there's no pressure on their nervous system. And our nervous system is so important. It's actually the first thing that develops in utero within 14 days of conception, which is amazing. So a lot of people will think, well, what is the first organ to develop? And yeah, it's your brain and then your spinal cord. And then from there on, that is what tells every other organ in your body to start forming. And it's just amazing to me that, you know, we start as 2 cells and then it becomes 4 cells and then 8 and then 16 and it's just, it exponentially increases and forms a baby. And it's a miracle. It's an amazing miracle of life. And yes, getting back to that. So we just want to make sure that from day one, that nervous system can continue to help the baby develop optimally from the get-go. So that's huge. And then of course, if that top bone is shifted, those are the things that become latch issues, because if the baby's head can't rotate to one side because of the lack of movement, there's going to be issues with breastfeeding. There'll be issues with colicky babies, so babies who can't poop at night, babies who just seem really uncomfortable, babies who are gassy. That's oftentimes the top being out. Those are the things that become ear infections. Those ear infections are the things that become headaches if they're never addressed. So it's easy to adjust a baby. And that is, if I take care of you through your pregnancy, that is something that I love to do for all of my moms. It's like my gift to you guys is cover that first adjustment to make sure babies functioning optimally right away. So anyways, I ended up doing a home birth, and we'll talk more later about that. I never envisioned myself doing a home birth. It's funny though, because Dr. Xavier did. I guess that's something that he's always, thought his wife would do as a home birth. But that's what ended up happening. And I switched at 32 weeks and it was amazing. So I'll talk more about that later. Okay, so I pretty much hit on this already. My goal is not only to lead a health revolution, but just to encourage moms that your pregnancy can be amazing, your birth can be amazing. And my biggest mission would be to eliminate the fear around that. So when I tell women that I birthed my baby naturally, people are like, "Oh my gosh, that's amazing!" And it is amazing. But anybody can do it. Like, women have been birthing babies for years, centuries. And just recently did we start thinking that we have to have an epidural. We have to have it because otherwise we can't do it. And if that's your attitude, that's fine. I'm not judging that. That's your decision. But I just hate that the media has the only parts of childbirth that they display are like the screaming and the horribleness of it. And it's just ingrained in our minds that it's this traumatic medical event. And it's not a medical event. It's not a condition to be treated. It's a miracle. It's a miracle of life. And speaking of that, so one thing that I did want to touch on is for women who have struggled to get pregnant. That is also something that I have dealt with that too. It took Dr. Xavier and I 15 cycles to get pregnant. I have the MTHFR gene mutation, so that's MTHFR. And if you haven't heard of that, it's extremely common. I think it's something like 60% of people have it and don't even know that they have it. And basically what that means is your body can't convert folic acid to folate. So majority of prenatal vitamins and pretty much any packaged food has synthetic vitamin B9, and that's folic acid. And if you have this MTHFR gene mutation, your body can't convert it. And if you're folic acid deficient, then that can make it difficult to get pregnant. It can cause, continuous miscarriages. So we think we're doing something great by taking this prenatal vitamin, but if it's not one that has folate, which there's not a ton on the market, there's only like 4 of them that I know of that have specifically folate. And actually now this one, Max Living just came out with this one, our prenatal packets, and they have folate in theirs. But then, you're essentially harming your body and harming the baby. So that's huge. And if you are having trouble getting pregnant and you have not been checked for the MTHFR gene mutation, you need to be. I kind of treat everyone as if they do have it because it doesn't hurt anything to do that. So make sure that your prenatal vitamin has folate and not folic acid, making sure that you're very cautious of eating foods that contain folic acid. So just flip it over, read your ingredient label. If you see folic acid, just stay away from it. which is a lot of packaged foods or foods that say fortified. So what fortified means is that they've basically taken stripped all of the nutrients out of that food during the packaging process or the creating the food, and then they put fake nutrients back in. That's what fortified means. So being careful with that too. So that's huge. I have many women who I know have struggled to get pregnant, and I'm like, did you get checked for MTHFR? And they're like, no, what's that? And more providers are becoming aware of this, but it is something that's pretty new and they're still learning about it. So I just say, hey, let's treat everyone like you have it, get you on a good solid prenatal. My favorite is obviously the one that we carry here. Now, when I was pregnant, Max Living didn't have this yet. So I took the Mega Food Baby and Me. Thorn is also another really great one. So that's huge. And then also making sure that you get a hormonal panel. So I would just be careful. This is just me personally. I would try everything that I can before, like immediately going to injecting hormones or taking metformin for pregnancy is something they're commonly doing. Or there's another one that starts with an F. Of course I know about MTHFR, Kathy. I'm MTHFR positive. So, and you know what? Given that, this just reminded me also, and this is going to be a very controversial statement, but I don't really care. MTHFR moms and babies are also the ones at most high risk for negative vaccine reactions. So if you are positive for it, that pretty much means your baby's going to be positive for it. And so you just need to be very careful and very selective as to which vaccines you do and do not do, because that's going to put your child at risk. So anyways, before I was going back on that. So your hormone levels. Okay, so I had this girl come in, and she had been on birth control for, I want to say 12 years. She came off birth control and she didn't get pregnant within 2 cycles. And then the suggestion after 2 tries was, okay, let's have you start taking these hormones. And I'm like, what? That's the craziest thing I've ever heard. You've been on birth control for 12 years. Your body needs to detox from the toxins of that birth control. And then your body needs to figure out how to regulate itself. And then you need to get pregnant. So that's wild to me. Birth control is also something, you guys are going to notice that the way that I talk, I'm like all over the place. So I'm sorry. It's just who I am. Hopefully you can follow and love me anyways. But yeah, so birth control is another thing that if you are on birth control for 5 years or more, your risk of breast cancer exponentially increases. So I am, against birth control. I'm big on natural family planning. They have something called a lady comp, and it is an investment, but it takes your temperature every single morning. And it basically, if you don't want to get pregnant, it gives you like a red light. And if you're fine, it gives you a green light. But Dr. Xavier and I just do natural family planning. And we figure if there's a surprise, then that's what God wanted. Okay, so hormonal panel. So obviously you want your progesterone and your estrogen to be in good levels, as well as your testosterone, your FSH, your LH. Now I have a pretty good understanding personally of estrogen and progesterone and testosterone, but as it comes to LH and FSH and all of those things, and TS, obviously your thyroid stimulating hormone, I know about that. But that's a little bit outside of my scope of knowledge, but I have great people that I can refer you to that can help with that. So for me, and this is very, very common, is most women are estrogen dominant because the personal products that you're using that have fragrances in them. So you put lotion on your skin that has fragrance, you're increasing estrogen. It's called a xenoestrogen in your body. It increases estrogen. It mimics estrogen inside your body and raises your estrogen levels. It makes you estrogen dominant and it makes it harder to get pregnant. So personal products, drinking out of plastic has xenoestrogens, storing your food in plastic has xenoestrogens, perfume has xenoestrogens. Perfume is one of the worst things you can do for your hormones. Just stop wearing it. Only wear it on special occasions. When you do wear it, spray it on your clothes. So balancing your hormones that way is huge. Another great supplement to take is called DIM. It's like, I don't even know how, dimethyl, blah, 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 something, but it helps detox bad estrogens in your body. Now, if you get pregnant, I would stop taking it. But if you're a woman of childbearing age, I would say start taking a prenatal and then take a women's hormonal supplement that has DIM in it or DIM alone. And if your husband has low testosterone, he needs to take DIM too, because men also have high estrogen for all the reasons I just listed, and high estrogen decreases a man's testosterone. So we've had men in the office, they're like, I just got my blood work and I have low testosterone. So take the supplement, their testosterone goes up. So that's huge too. And then cortisol. Cortisol is one that is not often checked. So cortisol is the hormone that when you're stressed out, your cortisol goes up. So as women, we are working full time, we are running the household, we're managing the mental aspect of the family. I mean, we do it all, and we're awesome because we can do that, but it absolutely raises our cortisol levels. And that's your stress hormone. And if your body is stressed out, it's not going to be thinking about sleeping. It's not going to be thinking about going to the bathroom. It's not going to let you get pregnant because it's not a good time, because right now you're running for your life, right? If you're running from the bear, your body's not going to be like, let's implant a baby. Nope. Even though that's what happened to, what's that zombie show, The Walking Dead, she was pregnant in the beginning. Anyways, I'm sure there's people that can't happen to, I'm sure. But I got my cortisol levels tested and they were crazy high. So then I had to, change some things in my lifestyle to allow my cortisol levels to decrease. So I had to stay aerobic during exercise. I had to make sure that I wasn't working 50 hours a week anymore. I had to make sleep a priority. So if you are having trouble getting pregnant, get your progesterone, estrogen levels checked, get your cortisol. I would prefer a 24-hour cortisol test, the one where you spit in the tubes all day long to see which part of the day you're messing yourself up at, and then getting checked for the MTHFR gene mutation. So hopefully that's helpful for any of you struggling with that. And of course, what does it mean if cortisol is low? Is that bad too? I don't think that that's bad. I don't know that I know the answer to that, Audrey, off the top of my head. That is something I can absolutely look into. I think that that's rare. I don't think that that's a bad thing, unless it's like chronically low. Let's talk about that next time you're in. I'll do some research and I'll see what I can find about that. And also I would be curious if that was just in your blood or if that was, 24-hour. And we'll see your Dutch test panel. That'll help too. Okay. So moving on from that, I think that's everything I wanted to talk about there. And then, well, of course, I can't believe I didn't even say this. Of course, getting your adjustments, the nerves. I'm trying to see if I have a Merrick chart in here. I should have brought a Merrick chart, but the nerves in the lower part of your spine down here. So yep, right down here, those are the nerves that go to reproductive organs. So if your lower back has a curvature or abnormal alignment or your sacrum is shifted, then that's going to put pressure on those nerves going to reproductive organs. You'll oftentimes have really heavy periods, painful cycles. If you're having really heavy periods or super painful cycles, definitely you have a hormonal imbalance and you need to get adjusted and make sure that there's no pressure on those parts of your spine controlling that. So I feel like that goes without saying, like, yeah, you need to get adjusted, but to me it does, but not to everybody else. Okay, so I'm going to keep moving here. You're welcome, Audrey. Okay, so this is when you are pregnant. Chiropractic care is huge during your pregnancy. One, I already talked about this in the beginning, but not only for comfort, but for your labor time. So there have been studies that have been done. If you haven't followed on social media, ICPA for kids. So it's the International Chiropractic Pediatric Association, and they put out tons of amazing information during pregnancy, not just on chiropractic, but just tons of great research. And I did a video about this, and it's on our Facebook page, I think 3 or 4 years ago. And I talk about this with every mom that comes into the office, but it's really cool information to have. And I'm just going to go through it super quick. So that way, if you have a pregnant friend, you can say, this is why you need to get adjusted. So one, it's very important to go to a chiropractor who's certified in Webster technique. So Webster technique is a different type of adjustment. And it's crucial that pregnant women be getting Webster technique. So this is why. So it helps with positioning the mother so that the baby can position him or herself optimally. And if the baby's positioned optimally, guess what? You're going to have a better labor and delivery. So studies have shown that women who get adjusted through pregnancy have about a 30% faster delivery rate. Okay, so here's how it works. This is the pelvis. Hopefully you guys can see this. Okay. So as you birth your baby, baby's either going to turn this way or baby's going to turn this way. If your hip is rotated, that makes it more difficult. The baby has to spin further as they are descending through that vaginal canal, or as they're trying to. So think about what contractions are doing. Contractions are the baby trying to position itself. I don't like to say it for babies. Position him or herself better so that they can get through the vaginal canal as well. So that's just a part of it. So if you're not rotated, guess what? That makes it easier for the baby to do what they need to do as they're going through. If one hip is higher than the other one, like this, now the baby has to do like one of these, right? And this, that's not going to be easy having to travel through just like this. So making sure that your hips are not rotated in any way. Also your pubic bone, can you guys see this? So if your pubic bone is shifted this way, that decreases the amount of millimeters for baby to travel through. You want every millimeter you can get, trust me. And then lastly, so we adjust that. And I hate to use the word separate, but I've never come up with anything better. But these joints right here, your sacroiliac joints. So this is why these commonly get sore during pregnancy. And for that, I recommend a sacroiliac belt. My favorite is the Sorolla belt. But these joints right here, they're going to separate, right? Not fully, but they're going to come away from the sacrum here a little bit. And it's amazing. Then your sacrum goes like this, right? And it, let's see, what's better view here. Your sacrum goes like this, right? And it opens up that spot so baby can travel through. And this is why it's ridiculous that women labor on their backs, because if you're on your back, what's going to happen to your sacrum? It's going to close up that spot and it's going to make it harder for the baby to get through. So freedom of movement during labor is huge. It makes a massive, massive, massive difference. Now, if you decide that you want the epidural, and you're going to have to be in the bed, but what they have is they have what's called a peanut pillow, and you can lay on your side, and that way your sacrum can do what it, God made it to do, and that's get out of the way. So getting this, making sure this is moving properly throughout your pregnancy, not only to help with the pain, but to make sure that it can move and get out of the way so baby can come through. That's very important. And you don't want to be doing any manual adjustments with the cracking and popping during your pregnancy, because since your body releases that hormone called relaxin and it makes you super cartilaginous, you can over rotate someone. So it's just about using the table. You're addressing the muscles and the ligaments, and then the rest of your adjustment can be the same. But Webster technique is very important during pregnancy. So just make sure your chiropractor is certified in that or knows how to do it. And that, yeah, it helps labor times immensely. So chiropractic for pregnancy, for all the things, for comfort, for labor times. It's good. It's amazing. Makes a huge difference. Okay. So during the first trimester, things that you'll want to start focusing on. So there are, tests that happen during the first trimester. So this is when they start testing for, I think it's when I have it written down here. They do chorionic, somebody help me here. Chorionic villus testing, I believe is what it's called. And they do an amniocentesis. So this is another thing that if you don't say like, hey, I don't want this, or hey, what are you testing for? They're just going to do it. And so a lot of that is genetic testing. So Dr. Xavier and I didn't want to do any genetic testing. Oftentimes these tests have false positives. I've heard of many, many stories where, women are told that there's something wrong with their baby, and they go through this whole pregnancy and they're so stressed out and they're planning and prepping, and the baby comes out and they're perfectly fine. Like, it happens often. And also for us, if the baby did come back and say with a chromosome abnormality such as Down syndrome, it wasn't going to change the outcome for us. We would never consider aborting our baby. So if it doesn't change anything, do we really need to know? No, you don't need to. So we denied all genetic testing. So that is something that you want to start looking into right away, because they do it relatively early and they'll ask you if you want to do that or not. So you can weigh the pros and the cons and kind of see where you're at with it. But if you some people want to know because they say, well, I want to be prepared. But I think it does create a lot of abnormal stress for people. So that's something to start looking into, your amniocentesis and your chorionic villus sampling, and then as well as blood cord banking. So we didn't do any of that. I'm sure there are benefits to that. I think it's kind of odd though to send part of my, I don't know. I don't know where they're storing it and I don't know what they're doing with it. And I don't like that. So that's just me. And plus I did placenta encapsulation anyways, which weirds a lot of people out, but I'll talk about that later. But that's another thing to start considering too. Also in the first trimester, you're going to want to start looking into birthing classes. So locally, we've got a ton of great options. We've got Hypno Babies with Christy High. We've got Hypnobirthing with Angela Shalenko. We've got Empowered Birth with Angela Garvin, just to name a few. Dr. Xavier and I did the Mama Natural one online, but just knowing anatomically what's happening with your body and what's happening, like everything that happens during the birthing process happens for a reason. And knowing what's happening as it's happening is so helpful because you can say, okay, this is what my body's doing now. This is what my body's doing now. And it just creates a confidence and calmness. And that's huge. And also it helps your husband or your partner get prepared too for what's about to happen. So you for sure want to take a birthing class. Again, I can help you find a good one that works for you. And then also locally, we've got a lot of Facebook groups. Or any of those local classes online? Yeah, actually, I know that Hypno Babies with Christy High, she is doing an online class. I'm not sure about Empowered Birth with Angela Garvin, but I did have someone come in the other day and I said, how are they doing this? And she said, it's online. I think it's via Zoom. So Mandy, I can, if you want to send me a direct message, I can see if I can get you hooked up with that information. Yeah, it is cool. It is cool being in the local groups, especially in person, because you get to meet, you know, other parents that are on the same journey as you, and there's kind of a community in that. But the online class just worked great for Dr. Xavier and I with our schedule. And it was still tons of good information there. There's also a lot of local Facebook groups. If you're not a part of them, there's the Birthing Naturally in Louisville. If you're considering home birth, there's Louisville Home Birth Circle. There are other pages there's a lot of pages. So if you're interested in additional ones, let me know. So for like the Crunchy Parents of Louisville, there's groups of those, so I can get you hooked up in those too. You also want to start looking into doulas. So what a doula is basically it's a birth. I don't know if this would be offensive for someone who isn't a doula for me to describe it this way, but basically I call them like a birth cheerleader. Which is, I don't know, that's what it was for me, and it was amazing. And they had, so I used Rebecca and Kate of Bluegrass Doulas, and they had so much information for me. I sat down with them, I talked on the phone with her for 45 minutes and sat down and met with them for an hour and a half. And I said, you guys just gave me more information than I've had in 7 visits with my prenatal care. Thank you so much. And they tell you, you know, okay, why don't you try this position? Why don't you try this position? They tell, you know, your husband how they can help. Although Xavier was amazing and he knew exactly what to do and he was great. But for husbands who might need a little bit more direction, they'll say, okay, now you can do this. And they just kind of comfort you and they keep you calm. And they're also an advocate for your wants and your needs. And if you're in a hospital and you want your birth to go a certain way, you need someone who's going to be an advocate for you for a lot of reasons. And I can talk a little bit about that more later. But if your husband is not 100% on the same page as you, and if if you don't think they're going to speak up, then I would say, yeah, get a doula. And it's amazing for a lot of reasons. So there's a ton of amazing doulas out here. And then ultrasounds. Okay, so that's another thing. So we did one ultrasound throughout our pregnancy, and that was because we wanted to know the gender. But also it was comforting for me mentally just to know that everything looked good anatomically. Now I know a lot of women who don't get any ultrasounds because they trust, God made our body perfect. God is developing this baby perfectly. Women didn't always have ultrasounds. But for me, it would have been more stress mentally to not have that. So I decided to get the one ultrasound. But there's some studies out there that suggest that, ultrasounds are really loud for the baby and really scary for the baby. There are some studies that suggest that it can change the way it can change cellular division. Some are linking ADHD to having ultrasounds in utero. So I really would limit them. Of course, that's my personal decision and my advice, but I respect any decision that you make. When you're with the midwives, they only offered me one. that was it. It wasn't even a choice, which is great. I'm like, do I get an ultrasound? They're like, it wasn't even mentioned. So I really actually appreciated that. And then if I would have gone past 40 weeks, I would have gotten another one because it would have helped me mentally. But I went 40 plus 2. We'll talk about due dates in a little bit too. I'm getting crazy. I'm talking about so much. I'm sorry. Hopefully I'm not overwhelming you guys. So yes, I would. And then I would never recommend a 4D ultrasound for several reasons. But I'm like, just give me the 2D, just give me the most basic that you can get. You can see what you need to see. So the 3D and the 4D, everything that I just talked about, that risk goes up even more. So just keep it simple. That's me. Okay. And then, okay, I think that's all I want to talk about with second trimester is when you start feeling better again. You start having more energy, you start to feel like a normal person. And then third trimester comes and you're tired again, and you're ready to give birth. I don't think I have too much more to talk about with the trimesters. Again, if anybody has questions, let me know there. Due dates is another thing I want to talk about. So most first-time moms, the average date that you give birth is 41 plus 1. So this whole 40-week thing, it's kind of wild to me. And the fact that for 2 of those weeks, you're not even pregnant because they go from the date of your last period, right? And then you have 2 weeks and then you ovulate and then conception happens. So really you're 38 weeks pregnant when you deliver. But oftentimes, if the baby doesn't come at exactly 40 weeks, I see these moms, they just have like this fear instilled in them that the baby needs to come now. And it's like, that's asinine. The baby's going to come when the baby is ready. And there's actually no science that says past 42 weeks is when further risk happens. And oftentimes they say, well, there's so much higher of a risk after 42 weeks. Well, show me the research on that. There's not. Now, personally, for me, if I would have gone to 42 weeks, I would have gotten, what's that test? A non-stress test and a placenta viability test, because you want to make sure, is your placenta still kicking? Because your placenta is an organ and it dies. You want to make sure that the baby's breathing well. You want to make sure that you have enough amniotic fluid. You want to make sure that the baby is positioned well and all of that. And if everything was fine, I would have kept going. I have one friend who went 43 plus 3, and I have another friend who went 43 plus 6, which poor girl, poor Jana. But they both had amazing home births, and the baby came so fast because the baby was ready. Like, the baby's gonna come when the baby is ready. And I see so many women, especially when it comes to induction, they get the induction and it starts this crazy cascade of events because the baby's not ready, the body's not ready, and then, okay, the baby's not coming. So then ultimately, and oftentimes it ends up in an emergency C-section. And it's crazy to me because if you wait until the baby's ready, the baby's gonna come. And of course, there are circumstances where a C-section is necessary and an emergency C-section is necessary. And thank God for that. 100% thank God that we have those options available to us. But it doesn't always have to be the answer. So that's a conversation that I would have with your providers. Like, what is going to happen once I get to 40 weeks? How far are you going to let me go past my due date? What are the recommendations going to be? Because I want you to be prepared and know what your answer is going to be and what you're going to do in that situation. So when the time comes, you're ready, and they're not saying like, we're going to take you back right now and we're going to induce you. Because then you're like, what? And you're taken aback, and it's emotional, and you're pregnant and big, and you're ready to be done with it, and it's just a lot. So I would say expect you're going to go past your due date. As I know some of you right now are like 36 weeks pregnant and you don't want to hear that, but just expect it. And if baby comes earlier, great. But almost give yourself at least an extra week. Yeah, and then find out what your doctors are going to do, and that's huge. Another thing that I think is kind of silly is when they check to see how dilated you are. You could be 2 to 3 centimeters dilated your entire pregnancy. You can be 40 weeks pregnant and only dilated 3 centimeters, and it doesn't mean anything because your body's going to go into labor when it's ready to go into labor. So it's super painful to check how dilated you are, and literally it doesn't mean anything. So your body can get smaller again, it can get bigger again. So it's silly and it's painful. I only was checked for that as I was delivering to make sure that I could push. Like, she just needed to make sure I was 10 centimeters dilated so I could start pushing. So that's another thing that personally, this is just my, personal experience and opinions, and, I have the science behind it too. But I respect anybody's decision. Okay, so make sure that you have a discussion with your doctor about due dates. And that you're very vocal about your wishes and your needs with that too. Prenatal nutrition, this is of course, I almost feel like I don't even need to talk too long on this because we all know how important it is to eat well during pregnancy, and really eat well all the time. So you can come to one of our nutrition classes. One thing I do want to hit on is protein. You need to get like a ridiculous amount of protein, especially if you are swollen, especially if you're super nauseous during your first trimester. It's all about protein. So a lot of times they want to say, well, of course water, but especially if you're super swollen, they want to say water, which you should be drinking a ton of water anyways, but it's protein. A lot of it. You're going to be like, oh my gosh, how can I get this much protein? Do it. I promise it'll make a big difference. This is our prenatal essential packet. So was my reminder to talk about the supplements during pregnancy. So of course your prenatal, I would also recommend a methylated B vitamin supplement. So going back to the MTHFR thing, you need to make sure that your B vitamins are methylated. So if you're on a B vitamin and it's not methylated, regardless of whether or not you're pregnant or have MTHFR, you need to switch to one that is methylated. Again, we're just going to pretend that everyone has MTHFR and you should be on the methylated one. So methylated B vitamins, probiotic is great, magnesium glycinate. So magnesium is amazing for the muscle spasms that you have during pregnancy. It helps keep you regular. So especially during first trimester, constipation is very common because your hormones are raising, and your hormones are needed to be able to go to the bathroom to eliminate. So magnesium glycinate helps with regularity. Vitamin D is something that really we should be on all the time, but especially when we're pregnant, to make sure that's a huge immune system boost is vitamin D. So you need to be on that. And then vitamin C is great as well. So in these prenatal packets, which I have right here, we have bone support, which I don't know if any of you have experienced this, but if you're not getting enough dietary calcium during pregnancy, your body will actually pull it from your own bones to give it to the baby. So this is why during pregnancy, like tooth issues are ridiculously common because your body's literally like pulling it from you, which is insane. So yeah, make sure that you're getting enough dietary calcium, but also what amounts of max living probiotics? Should those just be 1 a day or more? Personally, when I got my blood work taken during pregnancy, I was like, hey, can you check my vitamin D levels? So, optimal vitamin D levels is going to be between 60 and 80, right? And for it to get flagged from your medical doctor, they say 30 or above, which is only to prevent rickets. None of the other anti-cancer immune system benefits are at 30 degrees, or not degrees, I'm thinking of Kurt, is at 30 nanograms per milliliter. It needs to be between 60 and 80. So I got mine tested and they said, well, we can't do that. And I said, I'm private pay. And they said, oh, okay, then we can do it. So it was totally an insurance thing that they wouldn't check my vitamin D, which is wild. But I got mine checked and it was low. I believe I was at 46 or 49. So personally, I took 10,000 a day. But a good rule of thumb is for every 1 pound of body weight, multiply that by 40, and that's how many IUs that you can take every day without having to worry about overdosing. And that's a maintenance dosage. So that's something that you should be on like all the time to maintain. So if you know that you're deficient, you can take a little bit more than that. Now, this is personally, I would feel weird taking more than 15,000 IUs, but with that conversion with that calculation that I just gave you, you shouldn't be taking 15,000. You wouldn't be anywhere close to that. So this, anyways, going back to this has bone support, a prenatal in it, and then also in omega. And we all know that omega-3s, healthy fats, are good for brain function, your brain function, good for babies' developing brain, good for kids. Yeah, if they have ADHD, their body is screaming for adjustments in healthy fats. So tons of healthy fats for kids as well. Exercise during pregnancy. Okay, so this is just a clinical observation that I have. So everything that I've talked about so far, I have research that I can provide for you. For what I'm about to say, I don't. This is just something after practicing for 7 years and working with a lot of women. An observation that I have is that the women who exercise throughout their pregnancy, their births are exponentially better than the women who don't. And I think when you give birth, it's an athletic event. Like it's hard. Like your body it's going through something, and it's going through something intense. And so just having some of an athletic foundation, I don't know. It's something I see, and I don't care what you do, but something. And I would say something more than yoga. And I think yoga is great, and I think you should do that because stretching the muscles, make sure there's not pulling. But again, that's just a clinical observation that I see. So make sure that you're moving during pregnancy, getting oxygen to all of your cells. It gets oxygen to the baby. It helps everything. So exercise during pregnancy is huge. Then there are, of course, different options that you have. You have your hospital birth with OBGYNs. We have midwives. I love personally being with midwives. A lot of people that come to me are with the midwives, and now we have options at Clark, we have options at U of L, and we have options at Baptist. They now have midwives as well. I don't think I'm forgetting anywhere. They just tend to be more natural minded or more holistic. Now, this isn't the case. I'm not like knocking OBs by any means. That's just what I've seen. And I do think there are some really great OBs out there as well. And then we have home birth options. And then I think home birth and water birth kind of go in the same category, which James, our little guy, did end up being born in the water, which wasn't the plan. So I switched to home birth personally at 32 weeks. So I switched pretty late in the game. I was going to be at Tree of Life, which I think is beautiful and amazing. And I see so many amazing stories come out of there. But I had some questions and some things that I was not okay with for James. And I didn't have the freedom of choice in that. So I kind of felt like if I wanted things to be done my way, then I had to be at home. And so I switched last minute, and it was amazing. And I loved it. So if you guys ever want more information on that, I know that that's a pretty rare majority of people who do home births. So I'm not going to focus on that for too long, but I'm more than happy for anybody that wants to talk about that. Now at Clark and U of L, they do have, you can labor in the tubs, which is amazing. They say water is like nature's epidural just because it takes all the pressure off and the weight. So if you can be in those tubs, it's amazing for all the contractions and the pain. And then, okay, so postpartum recovery. Okay, so this is one thing that I just had this conversation with a practice member the other day. She's in her second trimester. I I feel like one of the things that was said to me right after I had James, and I understand it now, but when I was, 2 to 3 weeks out from having him, and it's hard. It's like a huge mindset change. Your whole world changes. For me, and this isn't the case for everyone, but it's hard. And people would say, just cherish these moments. And I wanted to be like, this isn't fun. This is so hard. My whole body hurts. I'm so tired. This kid screams constantly. And I don't feel guilty about saying that, but I feel like there's so much pressure to just, like, I did feel instantly bonded to him, but it's very common that women don't feel instantly bonded to their baby. Like, for some women, it takes weeks. And I feel like that's where a lot of postpartum depression comes in, because it is really hard and you expect it to be blissful and you expect to just be instantly bonded, and that doesn't happen for a lot of people. So for me, I was bonded, but it was so hard. And I want you to know that ahead of time, that it's okay to have those feelings. And it's okay because your body, there's a lot of hormones going on, and you're going to be bonded to your baby, and it's going to be the best thing in the whole world. You're going to love that little thing so much, but it's okay if it takes a couple weeks. So I have to throw that out there because it's so common and it's not talked about enough. And also, take it easy on your body. I talk about this all the time. So if you're pregnant right now, you need to not use your core. Don't use your core at all. And after you have that baby, don't try to not use your core for like 6 months. And I know that's easier said than done, but even like sitting up in bed, you should be doing the roll over, walk up the bed. Don't do toes to bar. Don't do sit-ups. The reason for that is you don't want to give yourself a diastasis. So a diastasis is when your abs separate and you still have all that relaxin in your body for 6 months postpartum, and you want those abs to come together. So if you're constantly using your core, they're not going to come together properly. It's also bad for your pelvic floor. So just make sure that you're taking enough time for postpartum recovery. You want to make sleep a priority as much as possible. I know common advice is sleep when the baby sleeps, but I had so much adrenaline going that I did not sleep when James slept. But I did, try to sleep as much as I could at night. So just make yourself a priority, because if you're a happy mom and if you're a healthy mom, you're going to be able to take care of your child better. So just make sure that you are prioritizing yourself as well. And again, I don't think that that's talked about often enough. So I hope that's helpful too. And then speaking of pelvic floor, I also recommend that all of my women go to a pelvic floor specialist following giving birth. That there's a lot happening down there, and you want to make sure that things heal well through there. If you have had babies and every time you sneeze or laugh or jump, you pee yourself, that's a problem. And that shouldn't happen. Or if you have painful sex, that shouldn't happen. And that's a pelvic floor issue. So we've got a lot of great pelvic floor specialists here. And basically, you just want to make sure that everything's clear, that everything is good to go. I think typically you can, after your midwife or your OB clears you, you can go to pelvic floor therapy or just to get it checked out. I think it's usually 6 weeks postpartum is when they recommend. Or if you get to a point in your pregnancy, like 28 weeks, you're peeing all the time. Every time you laugh, you need to go to a pelvic floor therapist. So I have great recommendations for that too, or I'm sure you can find someone close to you. So that's part of postpartum recovery too. And then exercise, we talked about that. My favorite exercises postpartum are from BirthFit. So you can go to like YouTube and type in BirthFit exercises. It's basically really slow and controlled movements to help, your core come back together. It's things like dead bugs and things like bird dogs, just really simple movements that are a lot harder than you think. So BirthFit is great. They're on YouTube. They have their own website. I'm not BirthFit certified. I don't think we have too many BirthFit certified people out here in Louisville, but you can still find the information out there. Okay, breastfeeding. Okay, so this is another thing. Breastfeeding is amazing for the baby. It's amazing for mom, but it's hard, and it's hard for a lot of women. And I do think this is something that is talked about more, is how difficult it is. And again, it's not difficult for everyone. Some people, there isn't any pain, which is awesome. But I think from the get-go, we're just expected to think like, this is just going to be natural for me. It's going to be natural for baby. And oftentimes it's not. And when I started breastfeeding, I'm like, how every breastfeeding mom doesn't get adjusted is beyond me. Because you're like this for like 6 hours a day. Your mid back is killing you. Your neck is killing you. So you're going to want to get adjusted through that so you're not miserable. But tongue ties are really, really, really common. So I don't know that I have enough time to go in depth on tongue ties, but basically this is another thing with the MTHFR gene mutation. If you have that, you can pretty much guarantee your baby's going to be tongue tied. I don't know why, it's just how it is. And we've got many dentists in the area that can help surgically like laser those. So basically this underneath your tongue, it's called your frenulum. And think about the job of our tongue is to like push food back into our throat, push water back into our throat and swallow it, right? Well, if your tongue is tied, then it can't go back. It can't go back very far. It'll be just right up. If that makes sense. It's kind of hard to show you on the internet via a webcam, but so babies who are colicky, babies who are really gassy, babies who it seems like nursing is very hard or uncomfortable for them. They're either tongue or oftentimes they're lip tied. If their lip is tied, they can't go like, you're supposed to phalange your lips. This probably looks so funny to you guys, but they can't phalange because this part of their lip can't lift up. And so then the baby's trying to like drink out of you like a straw, and it's extremely painful. So yeah, getting that corrected will make breastfeeding, it's a completely different experience. So make sure that your lactation consultant checks for that. And if they do and they say it's negative, but breastfeeding is still like after 2 weeks, extremely painful and difficult, I recommend getting a second opinion, because not everyone knows what to look for with that or gives the best advice with that. So that's something that tongue ties, I think, have had like a 600% increase in the last 10 years, which is insane. But it's super, super common. But another thing with that nobody tells you, that after you give birth, when you're breastfeeding, what it does is it helps your uterus contract. So like your uterus, it's really small, okay? And then during pregnancy, it stretches. And then after you have the baby, it starts going back down. And so breastfeeding actually helps shrink your uterus back down, which is amazing that happens. But because of the hormone that's released, the oxytocin, when your uterus starts contracting back down, it hurts. It's like you're having contractions again, like birthing contractions. So be ready for that if you didn't know that's coming, and know that it's normal and that gets better after a few weeks. And then, yeah, the benefits to baby for breast milk is absolutely amazing. It's liquid gold. It's the most, pure food, the most nutrient dense food that you can ever, give your child. And if it is difficult at first, I would say, give it a few weeks and keep trying. And if it doesn't work out, there's no shame in that either. There's no shame in that. So I just see so many women who are so hard on themselves because they did end up getting the epidural or they couldn't end up breastfeeding, and it's okay. Like, what matters is that you love your child. But there is a lot of support out there for breastfeeding. So if that is something that you want, then, I'm here to help you. There are lactations out here to help you. There are dentists that can help you. So I would love to help you with that. And then I did want to talk about the epidural. So what's crazy to me is a lot of women, they walk into the hospital and they're like, give me the drugs. Like, that's just the culture of today, which it's fine, but that's actually going to slow your labor process down. So when you have contractions, they're a positive feedback loop. And so your body is producing a contraction so that it can push the baby out. Okay, so if you're given an epidural, which relaxes your entire body, it's going to make it so that positive feedback loop doesn't happen as well anymore, and it relaxes you. So then your labor is longer because it's not producing the contractions faster and faster and harder and harder. Like that's what your body is doing, is it's producing a contraction. And it's like, yep, we want to keep doing this. We want to keep doing this. We want to keep doing this. But then you get the epidural and it's like, oh, okay. So you're going to make your labor process longer, which again, if you're like, I'm a baby for pain, I know I want it, that's fine. I can respect your decision, but just know that that might happen. Now, I have heard the flip side of that, though. I have had some women who've done a 20-hour labor and they're so exhausted, and you just get to that point where you're like, I can't do this anymore. And then they get the epidural and it's the opposite effect. Like it relaxes them enough to where they can have the baby. So I do think it's different for everyone, but just if you get it early on, know that that's a high possibility for that. Okay. And epidurals. Oh, group B. I wanted to talk about that. Oh, this is if you have breastfeeding supply issues. Adjustments, fenugreek tea, water, fennel and garlic. There's the mother's milk tea. That one's really good. And then I wanted to talk about, oh, where is it? I can't remember what I was going to talk about now. Okay. And then, of course, chiropractic care, maintaining that. I mean, there's no way your body's going to be expressing health at the fullest capacity if you're not getting adjusted. Your brain and your spinal cord controls every single function in your body, right? For your body's brain to develop, for your baby's brain to develop, this is another thing. Okay, so we talked about the cranial bones, right, shifting during the delivery process. If any part of that cranial bone, so obviously your cranium, your brain is inside, if one of those bones is shifting, putting pressure on that spot of the brain, that spot in the brain develops slower, right? So this is why cranial work following delivery for babies is super important. You want to shape the head to make sure there's no points of pressure on that brain. And making sure, babies don't have a cone head or a flat spot on their head. All of that can be worked out with some super gentle cranial work. So that's really important too. But yeah, making sure that your brain can always communicate with your body. That's the only way that you're going to express health in the fullest capacity. So you have to be addressing your spine in order for your body to be healthy. Of course, there's a Merrick chart. Oh, there's a typo on here. I'm really bummed that I can't remember the one thing that I wanted to talk about. One last thing. It was, it was on group B strep. Okay, so that was the last thing I wanted to talk about. So when you get your group B strep, okay, so the thing with that is you want to, I want to talk about vitamin K too. With group B strep, okay, you get that test, I want to say it's at like 35 weeks. So you want to make sure that you're doing everything you can to boost your immune system. So if your immune system is low, this is how you get viruses. This is how you get strep infections. So your immune system has to be able to function well. So things like bone broth is great. Raw garlic is great. Your adjustments are great. Vitamin D is great. Exercise is great. Decreasing sugars. Sugar is huge, especially with vaginal infections because of yeast. So with group B strep, if you test positive, what they're going to want to do is as soon as you come into the hospital, they're going to want to put an IV antibiotics. And that takes away freedom of movement during labor. So if you envision yourself having freedom of movement, you have to make sure that you test negative for group B strep, or you can deny it. I did not deny it. And I don't recommend that, but you can. Some people do. So if you have this IV inside you, then you can't move around. And freedom of labor, freedom of movement during labor, I keep talking about that because if you want your labor to progress, you're helping the baby by putting yourself in a position that you're more comfortable in. So you can be on all fours on the ball. You can straddle the toilet for a little while. I'm not saying birth your child on the toilet, but some people do, but you can straddle the toilet for a little while. You can birth in the tub. You can, hang on to something. You can squat. There's all these different positions, and it makes a difference with your labor time and with your pain. immensely. And if you test positive for this, it's not the worst thing in the world. I'm not trying to scare you, but I'm trying to say, like, boost your immune system so that you test negative so that you can have freedom of movement. And then also testing negative the first time is more ideal. So I have a friend who tested positive. She did all of the things I told her to do to boost her immune system. She went back 2 weeks later, tested again, tested negative, and they still said, okay, well, because you tested positive the first time, you're still going to have these IV antibiotics. And we all know how I feel about antibiotics. And so it's like basically from day one, your baby's gut flora needs to be replenished. So again, baby's going to be okay. You're going to be okay if that happens. It's okay. But if we can do things to avoid it, let's do it. So that's huge. Hopefully that makes sense to you guys too. And then the last thing was the vitamin K shot. So basically, as soon as baby comes out, they want to do. That's super helpful. My test is Friday. Good. I'm so glad that you listened, and you'll be doing that stuff, Mandy. Oh, whoopsie. Sorry. I don't know if you wanted to announce that. Okay. As soon as your baby comes out, they're going to want to do silver nitrate I think it's silver nitrate. They're going to want to put this goop on the baby's eyes. If you've never had or don't actively have a syphilis infection, then I'd say go ahead and deny that. There's no reason why your baby needs chemicals in their eye right away. I don't understand that. The Hep B shot, which was originally intended for promiscuous males, and then they started marketing it, and males didn't come for it. So then they started marketing it to younger and younger and younger, and now they just give it to our babies as soon as they come out. So I would research the facts about that and whether or not you want to do that, as well as the vitamin K shot. Vitamin K, it is a vaccine, and yeah, I guess I don't really need to have that. If you guys want information on those types of things, then you can talk to me individually. But that was why I decided to do a home birth, because that was something we didn't want to do. We didn't feel comfortable with it. And the only place where I didn't have to do that was at home. You can do drops though. Drops are a great option as well. So yeah. I am happy to give you more information about that if you want. I think, does anybody have any questions? I know I covered a lot, and I know I'm all over the place. That's just who I am. But yeah, if you guys don't have any questions, I'll just kind of be on for a couple more minutes, but I'm more than happy to answer those questions. And thank you guys for listening in. If you haven't commented yet, put a comment on here, because the comments are what's going to enter you into the raffle. So go ahead and just drop a comment, whatever you want, and that'll enter you in the raffle. Even if you listen later, that's fine. We'll probably raffle it off in the middle of next week. But that's how we know. That's how we know who to enter. Yeah, thanks guys for listening in. Hopefully that helps. I want to see all of you and take care of all the mamas and babies.